All right, let's talk about the very framework of our bodies, our bones. Now, I know what you might be thinking, but I promise you, by the end of this, you'll never see your skeleton as just a static hanger for your muscles again. You'll see it for what it truly is, a bustling, dynamic, and very much alive city within you.
So, think about this for a second. When you picture your skeleton, do you just see a rigid, lifeless scaffold, a simple frame that just holds everything up? If you answered yes, then get ready to have that whole idea completely, reconstructed. Because yeah, our skeleton is so much more than a simple frame. It's actually a complex living organ system. It's got a whole host of responsibilities that go way beyond just giving us our shape. And the amazing thing is just how many jobs your skeleton really has. I mean, of course, it gives us support, it protects our vital organs, and it works with our muscles so we can move. But did you know your bones are also a factory? Deep inside, in the red marrow, they are constantly churning out the blood cells you need to live. And on top of that, they're like the body's central bank for crucial minerals, especially calcium. That's right. The bones you have today are not the same ones you had a decade ago. They're always in a state of renewal, constantly being broken down and rebuilt, all on a microscopic level. And that perfectly sets the stage for our next section, where we're going to meet the crew that's responsible for this incredible nonstop project.
So let's meet this tiny construction crew that works tirelessly inside you. This whole process is called bone remodeling, and it's like this delicate dance between demolition and new construction that keeps your skeleton strong and healthy.
And here are our two star players. First up, we've got the builders. These are called osteoblasts. Their job is to lay down all the material to form new bone. And then you've got the demolition crew, the osteoclasts. These big cells release enzymes that dissolve old, worn-out bone, basically clearing the site for the new construction. And we're not talking about a slow, leisurely pace here. Just think about the scale of this operation. About a fifth of your entire adult skeleton gets replaced every single year. It's a massive, continuous renovation happening right under your skin right now. So, here's the most important part. Your skeletal health depends entirely on keeping a perfect balance between the builders and the demolition crew. Scientists call this coupling. But what happens when this crew gets out of sync? This is where we get into what happens when the system breaks down. When that balance is lost or uncoupled, the demolition crew can seriously overtake the builders, and that leads to a whole host of diseases that really compromise the strength of our skeleton. The one you've probably heard of is osteoporosis. This is the classic example of uncoupling. The osteoclasts, our demolition crew, are just working way too fast, breaking down bone much more quickly than the osteoblasts can rebuild it. The result? You lose bone density, leaving your bones dangerously weak and fragile. And this slide really gives you a stark visual of what's going on. On the left, you see healthy bone tissue. It's a dense, strong lattice. But look at the right. That's osteoporotic bone. The internal supports have thinned out, creating these large, weak pores. This is why a primary sign of osteoporosis is fragility, often leading to really devastating fractures, especially in the hip and spine. So what causes this imbalance? Well, there are a few main triggers. Postmenopausal osteoporosis is directly tied to the drop in estrogen, a hormone that normally helps keep that demolition crew in check. Then there's age-associated osteoporosis, which happens as our building crew, the osteoblasts, just naturally get a little less active over time. And you can also get secondary osteoporosis, which can be a side effect of certain medications, like corticosteroids, that speed up bone loss. But it's not just about osteoporosis. With osteoarthritis, the issue isn't bone density, it's the cartilage in your joints. It breaks down, causing painful friction and stiffness. Sometimes it's even described as bone grinding on bone. With rickets, a lack of vitamin D means the body can't properly harden bone, which leads to soft bones and deformities. Even scurvy from a vitamin C deficiency can weaken the skeleton. And then there's Paget's disease. That's when the osteoclasts just go haywire, creating new bone that's bigger but disorganized and structurally weak, causing pain and fractures. Okay, so after hearing about all the things that can go wrong, you're probably asking, how can I be proactive? What can I do about it? Well, let's open up the owner's manual for our skeleton and find out how we can support our remodeling crew and protect this framework for life. Let's start with this one. Staggering number, 99%. That's how much of your body's total calcium is stored right inside your bones. I mean, if that doesn't make it crystal clear why what you eat is a cornerstone of skeletal health, I don't know what will. When you really boil it down, our bone health rests on three core pillars. our nutrition, which gives us the raw building materials, our hormones, which act like the project managers, and the physical stress we put on our bones, which is the signal to build stronger. So here's your toolkit. On the nutrition side, calcium is king, but it needs a team of helpers like vitamins A, C, D, and K to do its job right. Hormonally, keeping things in balance is key, just like we saw with estrogen's protective role. And finally, exercise. The mechanical pull of our muscles on our bones is one of the most powerful signals to tell our osteoblasts, hey, get to work. And if you need any more convincing on the power of exercise, just look at this. A 30% loss of bone mass in just a few weeks of being inactive. It's a dramatic illustration of that old use it or lose it principle. Without the stress of movement, the body basically says, why should I invest in a strong skeleton, and stops trying? So we'll end with this thought. Knowing that your body is building you a brand new skeleton roughly every 10 years, and knowing you have the tools to influence that entire construction project, the real question is, what will your next one look like?